Hi, everyone. Welcome back to the Real Life, Real Hope podcast. I'm Maureen McGuire. I'm Senior Vice President with Behavioral Healthcare Provider, Community Health Resources, CHR. And today we have a special roundtable discussion, though it's not a roundtable. And we are going to hear some more about mental health first aid, which is an exciting new initiative that CHR had launched in the last few years.
You're listening to the Real Life, Real Hope podcast, brought to you by CHR.
We're going to start with one of the trainers, Stephanie Hills. Stephanie, tell us a little bit about yourself and maybe just a quick introduction. What is mental health first aid?
So mental health first aid is a public education program that really teaches people how to recognize and respond to the signs of a mental health or substance use challenge. So if you picture, a regular first aid CPR class, you learn in that class how to recognize if somebody's having a physical health emergency and then how to, kind of step in and provide care before you can connect that person with appropriate medical professionals. Mental health first aid is that same idea, but instead of physical health challenges, we're really focusing on mental health and substance use challenges. So how do we notice when somebody is struggling, and then understanding what our role is? How do we intervene and help? But ultimately, our goal is going to be the same, which is, connecting them with an appropriate professional.
And so this is a training that is for anyone. You don't have to have a special, credentials going into it, or
Yeah, anyone and everyone.
Just like CPR would be for the public.
Yeah, and that's one of the goals of mental health first aid. We want everyone, if you ask a room full of people, most people are going to know what CPR is, or at the very least, they're going to know, hey, we got to call 911 if somebody's having a health emergency. Mental health first aid aims for the mental health component of that to be just as common and well known as the CPR component.
Wow. So tell us a little bit about you and how you got involved as a trainer.
Yeah, so I've been with CHR for going on 2 years. Prior to transitioning into community health, my background is in education. So I'm a Connecticut State Certified Health Educator. I spent 4 years in higher ed, 8 years as a middle school health teacher before deciding to transition to the community health aspect, which is what brought me to CHR, and I'm really happy to be here.
Fantastic. Well, let's keep going with introductions, and then I know we have some other questions to cover.
Great. Hi, I'm Lisa Hardcastle. I've been with CHR, 24 years now, a little over 24 years, going on 25 next spring. A variety of different roles. I've been worked with, the clinical side, the administrative side. We got involved, 3 years ago with a grant through SAMHSA. Initially is how I became a mental health first aid trainer initially, and we provided those services through the grant, which was great. And then we decided to launch this at CHR through our own initiative and our own training program, which we've been working on for this past year or so. So it's been really exciting. So I supervise, I am trained in adult and mental health first aid, and also in youth mental health first aid. But I also supervise 2 of the other trainers, and Stephanie's on our team. So it's a great program, and I really enjoy it.
Fantastic.
I'm Megan McGregor. I came on to CHR about 3 years ago as a mental health first aid trainer. Now I supervise our community mental health training programs. Prior to CHR, I was a military suicide prevention subject matter expert, so specializing in suicide prevention, substance use, and resilience skills for the military and veteran population. And one of the great things about mental health first aid is we're able to connect to so many of those demographics and populations. So we're really able to provide some community-specific trainings to groups that maybe are at a higher risk of suicide or mental health challenges. So we're kind of able to bring in all of our personal experiences to really help those communities in their struggles with mental health.
Wow, fantastic.
Hi, I'm Elizabeth Bernier. I've been with the team for about 1.5 years now. I'm a youth and adult mental health first aid trainer. Prior to that, I've been in the military, the Connecticut Army National Guard, for almost 13 years, which is crazy to say aloud. So that's how I came to the program with my experience with Meg. I'm also a registered nurse. I worked for the Department of Mental Health and Addiction Services, specifically in addiction services, for about 1 year. And then I decided to move to Philadelphia. I live there currently, and I'm a registered nurse. I work on a behavioral health unit for Temple University. So just surrounded by mental health, it's really a passion of mine. So that's why I love being a part of this program and part of this team.
Wow, fantastic. What a great team. We're so lucky. So just a question for the group. Why is mental health first aid so important for the community?
I think one of the biggest aspects for me is that people want to help. As humans, we want to support each other. We like to be in groups, we like to interact with each other. And if you see somebody struggling, a lot of times people want to support, they want to help, but they don't know how. So we're really trying to give them those skills and a plan to use so that if they see somebody struggling, they know what to do. They can step in and they feel empowered to make those decisions and support each other.
So important because so many times people are just at a loss. They don't know what to do. Mm-hmm. It's not as obvious. If you see someone trip, you want to help them get up. But sometimes it's not as obvious when someone's going through mental health or substance use or suicide risk.
Yeah, absolutely. I think it's also like just kind of breaking the stigma, coming up within the military. It's still a stigma that exists within the military, and then working with patients on a one-to-one basis within being a registered nurse, and just seeing how, that stigma still exists for people that are really struggling. So just trying to make it more of a conversation and making it more comfortable for people to talk about, I think is extremely important.
Yeah, like Elizabeth said, having it be part of that conversation. I feel like one of the biggest feedback things we've gotten in doing trainings is people have been so appreciative of not only understanding what the signs and symptoms are, but also how to approach someone and what to say, like really what to say, how to say it, what to say, because they really do want to help, but they're not quite sure how to, broach the subject or, what would be the best way to say something. So really giving people that language and those skills are really important. Mm-hmm.
So what interested you, just for the whole table, what interested you in mental health first aid? What drew you to this work?
Yeah, for me, my background is in education. I care a lot about helping young people. And I had the opportunity to attend several different, community mental health trainings after I left the classroom. And I was sitting, it was actually an assist training, and I was, on a break during this suicide prevention training, and I texted my husband and said, I think this is what I want to do, because I was questioning, like, what do I want to do after the classroom? I pictured myself teaching forever. I was like, I think I want to teach, like, people who work with young people who work with, other populations, how to provide support. And that sort of started this whole big career shift for me. And so I really appreciate the opportunity to connect with other teachers. As a health teacher, I was often the safe adult for a lot of young people to come talk to if they had struggles. We had entire units about mental health and suicide prevention, but the science teacher or the math teacher isn't necessarily expecting to have that conversation, may not be comfortable having that conversation, but kids don't know any different, right? Kids find their safe adult, and the math teacher might be their safe adult. And so that excited me, the opportunity to help other, professionals who maybe don't have a ton of experience having these conversations feel more comfortable and able to provide support to their students.
And if I can elaborate on like the whole comfort thing, for me, it was a big aspect of feeling comfortable. I see a lot when on my unit that I work as a registered nurse, a lot of nurses don't like floating to our unit because they don't necessarily have the background or the training or the comfort to deal with someone that might be going through a mental health crisis. And for myself, I felt like I found that comfort at a young age of being able to, whether it talk about things that I've gone through myself or being able to help somebody through it. So I felt like because I kind of had that comfort and that calling, that it really drew me into this field of wanting to be able to continue to help people the best that I can and give them that comfort within themselves or with helping other people.
Yeah, I think creating the comfort and the uncomfortable is a big aspect for me. I've been involved in suicide prevention, studying suicidology for the last decade or so, and I've become very comfortable with the topic. And I think being able to bring that to groups is what interested me. If we talk about suicide, if we talk about mental health challenges, we make those resources more accessible. We make people feel more comfortable if they have an issue finding somebody to talk to. So I think really giving a public health approach to things like substance use and suicide prevention, where the more we talk about it, the more awareness we generate. And once people are aware that there's an issue, they're more likely to get involved. They're more likely to try to find the resources themselves or to seek out, like Stephanie said, those safe individuals. I think we have this perception of who should be dealing with these issues, psychiatrists, psychologists, social workers. But at the end of the day, if you're struggling, it's unlikely that's your first step. You're probably going to talk to the people around you, your friends, your family, your coworkers. So being able to give them the skills to address the issue really sets the stage for a positive recovery and a positive experience. So being able to give people who maybe didn't think that they could do this, the skills and the knowledge to be able to do it.
So you talked a little bit about youth and some of your work with veterans. Are there specific audiences that we're trying to reach through this program?
Yeah, so we're fortunate with some of our grant funding that we do have some specific populations that we're trying to reach. And I can let Stephanie speak to that a little more. But, as trainers, we always try to broaden our horizons. So I think we have a multitude of community-specific trainings amongst us. So to include the veteran and military populations, higher education, I think we also have our public safety ones, so to the fire, EMS, corrections. But I know Stephanie can talk a little more about the populations we're focusing on.
Yeah, so you mentioned a bunch of them. I work under a 4-year SAMHSA grant. We're in year 2, so there are specific populations that we target with this training. So like Meg said, we have focus areas for community college staff and faculty, K-12 staff, veterans and military members, or like loved ones of veterans and military members. Criminal justice professionals is another target area, and human and social services.
So it's really a broad range
throughout
the community.
Yeah. Which is amazing because you sit in a class and you have a ton of different perspectives, and you get to hear how this one course is really impactful in so many different areas.
Right. Lisa, what are some of the organizations and groups that CHR has worked with recently?
Oh, we've done some colleges and done some trainings at colleges. We've done some just community groups, and we've also trained a lot of our CHR staff, which is a lot of fun. I know Stephanie's trained our staff as well, because we're training. We open the trainings up to everyone. So we're training front desk staff, we're training administrators, we're training clinical people. So it's a whole host of people that you don't have to have that clinical background, even though we're a behavioral health agency. It's for everybody, just like it is for the community. We've trained, Meg, who was it? The folks who do the Husky Dental program?
Yeah, the contractors for the Connecticut Dental program. We've also done trainings for the judicial branch in Connecticut. So some marshals, probation, parole officers, their administrative staff. We've worked with Amazon quite a bit to give them some training because they have some large locations within Connecticut. So we're able to really touch many people with the trainings there. We've also been able to train with Raytheon, so through United Technologies, giving some training to their flight staff, which is really helpful. Yeah, they really enjoyed the training. It was great to see them there.
As you go out and do the trainings, what's your favorite part?
I think for me, the best part is really having people say how much better prepared they feel to have these difficult conversations, or conversations that they felt like they could not have before because they weren't sure, is it an issue? Is it a problem? Is that really someone experiencing a challenge? And being able to recognize those signs and symptoms, and then feeling comfortable enough and secure enough within themselves to be able to say, no, I can have this conversation. It's important that I have this conversation. If I was struggling, I would hope that someone would be there to support me. And I think that's been the biggest change. And the thing that I've been most excited about is watching, language is powerful in being able to have, the means and the knowledge and the confidence to be able to ask a difficult question and to be there and listen non-judgmentally and be able to be with that person in a way that they really need you to be with them, and then help figure out okay, it's going to be okay. We're going to figure out what you need. We're going to figure out ways to support you, and being able to carry them sort of through that whole process and feel confident about it has been, I would say, one of the most exciting parts about doing this for me.
Yeah, adding on to that, one of the parts of mental health first aid, they really put a focus on understanding the role that culture and identity play in how somebody perceives healthcare, mental health, how comfortable we feel talking about it, how we make health decisions for ourselves, who we involve in those decisions. And one of my favorite parts during the training is really hearing people share how their own cultural identity, their own personal identity connects to exactly what we're talking about. Somebody might share like, yes, exactly. In my family, we grew up not talking about this, and this was, something you kind of brush under the rug. And they start to put all of these connections together, and it really helps us and the people listening to these stories understand different perspectives, and really gives us concrete examples of, hey, like not everybody is comfortable talking about this, and there might be like really valid barriers that we as mental health first aiders have to, work to push through or work to accept, because not everybody's going to be willing to, take our advice or seek professional care. And so, hey, in those cases, what do we do? How do we validate that person's experience? How do we accept that, and still be able to, provide whatever support we can, even if they're not open to exactly, what we're offering?
I think it creates a space to ask questions. I think often people have questions related to substance use, mental health, suicide, and our society is such that you don't really have opportunities to ask many questions in your day-to-day activities. We create this space where if you have questions, let's talk about them. Like, what questions do you have? What have you seen that you're not sure about? And like Stephanie said, all these scenarios that they bring up, like, well, what if this? What if that? And we're able to kind of work through those situations with them, because I think people come in like with worst case scenarios. Like, if this terrible thing were to happen, how would I deal with that? And we're able to kind of give them the space to work through that as a group and with instructors who can give them, some practical knowledge and experiences, but kind of allowing that space to ask whatever questions they feel they've had about these topics that they've never been able to get answers to or to get some information around. A lot of it is information sharing and correcting myths and being able to give them the opportunity to vocalize their feelings on the topic.
I think that's what I love about this program too, is that it's not just like us sitting there teaching, about mental health first aid. It really is a conversation, and it's a space where, we go off on conversations sometimes, and we have to bring it back in because, everyone becomes so passionate and so involved in like what we're talking about and just different perspectives or different, cultural differences and things like that. So it's really great to see like everyone feel comfortable in that space to be able to have that conversation and bring in their own perspectives.
So you really get to see people open up about this because, as you said, it's a topic that a lot of people just don't feel comfortable talking about in a day-to-day
Yeah,
setting.
absolutely. By the end of it, like I said, sometimes it's almost like hard to bring it back in because all of a sudden you're having these conversations because you've created this safe space for people to finally talk about something that maybe they have wanted to learn about or talk about and they just haven't felt comfortable enough to.
That's a good time to just, if we could just get an explanation, like what does the course entail in terms of hours, and online, in person, and that type of...
Well, so the nice thing about mental health first aid is we can kind of tailor it to the group. So by that I mean we can offer in-person trainings, we can do virtual trainings. We offer blended versions, so some online pre-work that's self-paced with instructor-led sessions. We can do it in 1 day of training, or we can break it over 2, and they don't have to be consecutive days. So our adult mental health first aid training is about, I think, 8 hours. And then youth mental health first aid is a little bit quicker. It's usually like 6.5-ish hours. Obviously, we build in time for those question periods and the discussion, but can be done within a work day.
So have you seen people come in with apprehensions, they're not sure what to expect, and then really get into the teaching and the conversation?
Oh, yeah, absolutely. Yeah. A lot of people, they start off very quietly. And the course is really structured in a really nice way so that it kind of starts you off kind of at the beginning and then it builds over each module. So the first part is really just sort of a welcome and introduction. This is what, we're going to be doing today. Then the next one is sort of that the recap of sort of their work previously, so all their online stuff. And we kind of go over that, make sure they understand certain concepts, have that a good grasp on that. And then it moves into what's next, algae, I always say it wrong.
Algae action plan.
Yes, the algae plan, which is the action plan. And then we go to signs and symptoms.
Early signs and
symptoms, then worsening signs and symptoms. And it builds up. So you get to the point where you're at crisis so that people are feeling a little more comfortable with the content. They're feeling comfortable with each other. They're starting to share. There's teacher-led, instructor-led activities. There's group activities. It's very didactic in the practice. And we do challenge by choice. So we never ask people to do things or answer questions that they aren't comfortable doing, so they can make that decision for themselves. And then it ends with this more reflective piece around self-care and care for the first aider, so that we kind of wrap up with that, and we make sure that people are taking good care of themselves, that they understand the importance of self-care if they're providing mental health first aid for other people. So I think it's a way to just kind of go through the course and feel comfortable and build competence, and just feeling comfortable across time as you go through it.
And you've done so many trainings. What type of feedback have you received from different audiences?
My favorite feedback has always been having participants go through the course and tell us, I'm not the person who can help, but now I know what to do. So there are some people you just might never feel comfortable having these conversations or approaching these topics, but now they know the resources that they could utilize. So if I'm not comfortable, I know who is. I know who I can get a hold of who can help in this situation. So I think creating that self-awareness for some people is really, it's eye-opening for me, because we just assume everybody will be able to do this now.
Right.
Some people maybe won't ever get there, but now they have the resources and support. So if they are the person who first encounters it, they will recognize what's happening and be able to get somebody else involved to help. So I love hearing that people have become a little more self-aware, understand their limitations and their boundaries, but can still help in their own way.
I really love when people come up to me at the end of the training and they're like, I want to bring this training to some other group or to my colleagues or this church group or whoever. Do you do trainings for other groups? And so many different training opportunities have happened that way, where someone sits in the class, finds it really valuable, and thinks in their own life about other people who might also benefit from this course. And so
Fantastic.
we get to bring it to other groups purely just because somebody found it helpful.
It's also given CHR the opportunity to look at expanding our offerings too, because so many participants enjoy the course, they enjoy the instructors, and they want to learn more. They want to know what's next. So it's given us as trainers working at CHR the opportunity to start to explore what would be the next training we can offer. Like, what else can we do for our community? So getting that feedback has really allowed us to further the program.
So what advice would you have for somebody who's maybe listening in today to the podcast and they're interested in mental health first aid, but just a little nervous about the whole thing?
I would tell them it's okay. It's okay to be nervous. I feel like lots of people, and I'm sure you all can agree that lots of people walk through the door feeling apprehensive in some way, right? They're not sure what to expect. We as instructors have to collect an emergency contact. And so sometimes people are like, why are you collecting the emergency contact? Like, what's going to happen here? And so one, if you're feeling nervous, you're not alone. Like, this is a difficult topic to talk about, and we all have really valid reasons why we feel the way we do about it. But I would say, take comfort in knowing that we're never going to force you to talk about anything. We're never going to force you to sit through something where you feel uncomfortable. And please know that every training that we do with two people. Purposefully, so that if Lisa and I are doing a training together and I'm up in front instructing, but Elizabeth is sitting in the audience having a really tough time, Lisa's available to Elizabeth at any point to debrief, to step out, to talk about something. We really encourage tapping into the self-care component that's introduced early on and then again at the end. So there is so much built in, and your comfort is the most important thing to me here, right? And I'm going to do everything that I can to make sure that you feel okay and that you're safe and taken care of during our time together.
I think it's important to know too, this is not a rigid course. Yes, we maintain fidelity to the course and follow the steps, but we have fun. There are times where we laugh. There are times when we can joke around and we can do some activities to get people up and moving. And we understand it's unlikely you're going to come into this course as excited or eager to talk about suicide as I am, but we can get you there. And I think it kind of catches people a little off guard, the comfort of their trainers in discussing some of these topics. And sometimes just disrupting their thought pattern in that method can make them feel a little more comfortable and kind of get rid of those preconceived notions about what mental health conversations might look like. And we encourage everyone to come comfortable. Like, so that might mean wearing comfortable clothing or making sure you had a good night's sleep, bringing your cup of coffee. If you feel physically comfortable, you're more likely to be able to engage in this course in a meaningful way. So we really encourage, again, in that self-care component, to bring yourself in the way that you feel best.
I don't think I've ever had anyone say, I didn't get anything out of this course, or I wish I hadn't taken this course. I have had many, many, many people say, I'm so glad I took this course. And people who've done it in their work setting saying, like, this applies to my personal life. Not just my professional life, but my personal life and my family and my friends. And they feel like they're equipped and skilled and ready to tackle conversations that they did not feel like they could do before. And now they feel confident and capable of doing that.
It all just is so tied in with breaking down the stigma and normalizing these conversations.
Absolutely.
I mean, what's the statistic that 1 in 5 Americans or 1 in 4 Americans will,
1 in 5.
will experience some sort of a behavioral health crisis in their life? And, you know, since the pandemic, that actually could be a lot higher, I think.
Yeah. And
absolutely.
another important piece of mental health first aid is that, you know, a lot of people aren't going to reach out for support on their own. And so as a mental health first aider, we're really focusing on how do we notice? How do we pay attention? How can we tell when somebody might be struggling? Because they likely will not just come up to you and say, hey, I'm struggling, I need help. And so being equipped with the skills to notice and reach out and initiate that conversation is crucial. We know that people are more likely to seek help if somebody close to them suggests it. And so you can be that person.
It can save a life.
Yeah.
Yes, you can.
Wow, this has been fascinating. Anything else anyone wants to add to the conversation, or how could people learn more or sign up?
So on CHR's website, we have some information about the mental health first aid program, so they can go there and then through the website can reach out to us, and we can get them in touch with either Stephanie or myself to start the process of setting up a training. CHR does throughout the year offer public trainings where anybody can sign up, so those will be on the website as well.
Well, thank you all so much. It's been a great conversation. You're doing fantastic work. We really appreciate it.
Thank you.
Thanks.
Thank you.
Yeah.
This podcast is brought to you proudly by CHR, where real life meets real hope. Visit chrhealth.org to explore resources and services. Be sure to like and subscribe wherever you get your podcasts. Please rate and review and join the conversation on social media.